So it is believed to have a multifactorial etiology, and the biggest risk factor is an elevated intraocular pressure. Elevated intraocular pressure, normal intraocular pressure is between 11 to 21 with an average of about 16 millimeter mercury. Anything more than 21 is considered a glaucomatous pressure. Commonest etiologies are a family history. Most of the times POAG, because a certain stereotypical genes can get transmitted among family members. Age of the patient, usually they are elderly age groups. Race of the patient. Patients in angle closure glaucoma, it is common in the Chinese and Mongolian races where the eye can be small. Whereas in patients with open angle glaucoma, it is quite common in Africans or even in Asians. And in the Indian population also, we see quite a few patients with primary open angle glaucoma. Now, central corneal thickness plays a very large role in patients in glaucoma, especially in two conditions which are considered a subset of open angle glaucoma, which is ocular hypertension and normal tension glaucoma. So, what are these words? I'll be talking to you in detail about it. Ocular hypertension and normal tension glaucoma. Myopia can also be a risk factor or a predisposing factor to glaucoma. Diabetes, hypertension, smoking and steroid responders. So, there are certain risk factors open angle glaucoma, and angle closure glaucoma, it can occur due to other risk factors which I'll be talking to you then. So, the point I'm trying to make here is you cannot confuse a primary open angle with a primarily angle closure. In the exam specifically, case scenarios will be given and clues will be given for you to identify based on the clinical scenario and write an answer based on that. So, pathogenesis of open angle of glaucoma is mechanical theory and vascular theory. It is believed that when there is a raised intraocular pressure, it can stretch the lamina cribrosa. This lamina cribrosa is actually present. It is a sclera. It is part of the sclera. It is present at the optic nerve head. So, we have retinal ganglion cells, and the axons of all these retinal ganglion cells together form the optic nerve. Now, this optic nerve leaves the eye in the retina at a place called the optic nerve head. So, this optic nerve that leaves the eye in the retina has, if this is the retina, this optic nerve leaves the eye, and this portion, this is the accumulation of all the axon, the retinal ganglion cells. So, this portion is called the optic nerve head, and the posterior most part here is the lamina cribrosa. So, this sclera's continuation is the lamina cribrosa, and when there is raised intraocular pressure, when there is so much of raised intraocular pressure, it can cause stretching of this lamina cribrosa, and it can even result in axonal degeneration and also ischemia. So, these are the two mechanical theories that have been proposed. Vascular theory is considered to be due to a failure of autoregulatory mechanisms in the eye, a vasospasm or a systemic hypotension, both of which can result in neuronal degeneration. So, that's what we're getting to. Both of this can result in neuronal degeneration, and retinal ganglion cell death can occur by apoptosis. By definition, the word apoptosis means premature cell death.